Okay, first one is licensor, means license. Okay, nurse employed for the nursing service required possessing a valid registration certificate issued by respective state nursing council or Indian Nursing Council. Registration aims to protecting patients by providing qualified nurse. Now I have given one example. Okay, forget about nursing and everything. I'll give one simple example of licensor, driving license. Okay, so there is rule now, right, in India that if you do not have a driving license and you are driving a car or a bike, then you will pay a fine. So driving license is what? Your legal safeguard. They are saving, that license is saving you from getting any legal actions. Okay, so that is licensor. Means you are licensed, that you are proof that yes, you have undergone some exams, you have undergone your training, and you have fruitfully passed those exams, and you are now able to practice that in your profession or in your life. Okay, so that is licensure. Next is standards of care. Each institution or hospital need to have the policies and procedures defining the standards of care for the nurses of different levels. These are the legal guidelines for safe nursing practice. Now, every hospital or every institution has some policies on rules and regulations, right? So those are the standards. It means those are written policies, not only to safeguard the nurses and the doctors, but also to safeguard the hospital as well as the patient. Okay. Next is standing orders. Nurses are required to execute prescribed orders. In case of emergency or the doctor or medical personnel is not available, each nursing service area should have standing instruction or orders for nurse to carry out. Now, okay, a nurse is not authorized to give medication until and unless a doctor advised to do so. We are not authorized to prescribe medication. Okay, a doctor has to write in the doctor's note that this patient will get this medicine. After that, only a nurse can go and give that medicine to the patient. Now, in case of some emergency, the patient is dying. Okay, you might have seen patient in films again. Patient getting CPR means that resuscitation, right? And giving artificial breathing and all. Then they are giving medication, some medication. The nurses are giving medication by themselves. So in those cases, in very emergency situation, we have some standing orders, means pre-written orders by the doctors, and which is approved by the hospital facility and the hospital committee. Okay, that in this emergency, if a nurse gives a medication without the advice of a doctor, then this one will not come under a legal problem, because the nurse was trying to save the patient. Okay, for example, like medication like adrenaline, atropine, where they used to give when the patient is having cardiac arrest, when the patient is giving CPR. Okay, so in those cases, we can give those medication without the doctor's advice if there are standing orders. Okay. Next is informed consent. Okay, from among you, has anybody undergone any surgery? Any surgery? Anybody? Okay, nobody. So in case somebody is planning for any surgery, is going to undergo any surgery, it is the duty of the doctor as well as the nurse to explain about the surgical procedure, about the risks that might occur in the surgery, and what are the benefits. If there was any alternative for that surgery, we'll have to inform all to the patient, and we will have to give the authority to the patient whether he or she wants to undergo that surgery or not. If that means we will take the patient's consent, and inform means we'll have to inform everything in detail. Okay, that is informed consent. Now a patient may be minor, maybe say 16 years, a pediatric patient. Now who will give the consent? the immediate relative, either a mother or father only can give the consent. Okay. In case if there is no mother and father, then anybody that the mother and father has approved as the legal guardian of that patient, of that baby, okay, they can give the consent. Okay. Next is current identity. Correct identity. Okay. All babies born in the hospital are correctly labeled at birth, and to ensure that no time they are placed in the wrong code or handed to the wrong mothers. All persons in the hospital should wear identity card. You might be seeing in hospital facility when a baby is born, they have put one tag. One tag is to be given to baby, right? Why? So that we can maintain the correct identity of the babies, so that the babies does not get misplaced. Then drug maintenance, checking the unlawful use of narcotic drugs is liable to drug dependence. These drugs should be kept under lock and key. As I have given example of morphine, that is also one type of narcotic drug. So those drugs which can cause drug dependence, or those which are very dangerous drugs, should be kept out of reach of anybody. Okay, only the sister in charge should have the key if she is putting it under lock and key. Okay. Next
मैम
is
नार्कोटिक ड्रग्स मीन्स मैम लाइफ सेविंग ड्रग्स होता है ना जो इमरजेंसी
no,
के
no,
सिचुएशन
no.
देते हैं हम लोग.
Narcotic drugs are, yes, life saving, but narcotic drugs like your morphine, opioid, okay, that may cause drug effects. Like those drug users, they use all these narcotic drugs, okay, that can cause your opioid, morphine, benzodiazepines, okay, all those, they are different groups. If I say, you will not understand. So narcotic drugs means they can make you dependent, they will make you a drug abuser if we do not use the drug properly. Okay, those are narcotic drugs.
Okay, ma'am.
Next is documentation. This is a very important, this documentation is very important if you come to a medical field. Anything you are doing, you will have to document. If you do not document properly, then that means you have not done that work. Okay, you have given one drug, you have given one medicine to the patient, you'll have to record it. At what time you have given, what doses you have given, what medicine you have given. If you have not recorded it, that means you have not done it. Okay, this documentation can save you from a lot of legal issues. Okay, so if by chance in the future you are doing work in any medical field or any hospital, anywhere, make sure that you are doing documentation very correctly and very properly, and for everything there should be a record. Okay. Now, what are the legal responsibilities of the nurses? So at different levels, I would tell, at administrative and supervisory level, means the nursing superintendent or the metro, appointing and assigning the nurses of, we will appoint and assign the nurses who are good in which area. Okay, we'll not just appoint and assign nurses anywhere. Now I have done specialization in pediatrics. I cannot go and do in surgery, right? Because I am for pediatrics, I am for child health. I will be focusing in only child related issues. So I will be appointed in that department. Next is quality control, where the quality of the hospital, be it the hospital environment, be it the care given to the patient, all these have to be taken care by the nurse who is in an administrative level. Then material management. Material management means to make sure that all the equipment, everything is available in the hospital and is in proper working condition. Next is proper documentation system, as I have already explained. If you go to, by chance, if you go to Downtown Hospital for your practice, then you can see how they are maintaining the documentation. There is file, patient file, as well as in computer also they are maintaining. Okay, so different hospitals have different documentation system. Effective public relation, mostly this one for the private hospitals. If you are not good in talking and building a rapport with the patient, then the patients will get hyper, then they might sue. The disaster management in case of any disaster, any flood, any earthquake, okay, all those, there is a, again there will be a different chapter, so I will not go to that. So disaster management, if there any disaster occurs, so the administrative level sister should be ready for that. Then staff management, management of staff, I have already explained. At operational level, that means the ward sisters who are present in the ward, carrying out the physician orders properly. Then verbal orders. So in case of verbal orders, sometimes what happens in case you are in night duty, okay? So what happens, you are in night duty and the doctor is not there in that ward, but the patient had some problems and you have to give some medication. So the doctor will give order over telephone. Then there will be one telephonic order record. You'll have to fill up that and keep, and next day when the doctor comes, you will have to take the signature so that you are safe. Okay. Next, do not resuscitate. For some patients, there is a sign like do not resuscitate. Resuscitate means giving CPR. You understand by the meaning of CPR?
Yes, ma'am. Yes.
Okay, so for some patients, for some conditions, there is a sign like do not resuscitate. You cannot resuscitate. So if that is written, we should not resuscitate. Okay, if there is any alert mishap, like suppose medication error occurred or patient fell down or burn happened, you have to be alert, and if it occurred, then you have to inform to your higher authority. Then maintaining of safe environment means those side rails of the bed, okay, the the floor should be not slippery. All those will have to take care. The use of safe
Ma'am,
equipment. Yes.
ma'am, do not resuscitate, ma'am. मतलब उसमें आपने
हाँ,
मतलब
resuscitate